and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning. It's Gil Lederman, Dr. Lederman. We're from Radiosurgery New York. Usually there's a few questions people ask, and they say, why don't you answer them? So I'm going to answer them in anticipation of the questions. We work at Radiosurgery New York. It's a private cancer treatment center. We take most insurances, Medicare, Medicaid. Our address is 1384 Broadway, 1384 Broadway. We're at the corner of 38th and Broadway, right between Macy's and Times Square on Broadway. We have a spacious, modern cancer treatment center. It's private, which means it's for you, not the drug companies. It's for you. We know you, you know us. We don't have miles of cold corridors, strange faces, oodles of locked doors. No, we know who you are. You know where we are. You know where the bathroom is. You know how to get to the bathrooms. We accept your insurances. We have a number. We answer day or night. You can speak with the doctor, not a machine, not a student. You get to speak to the doctor, which is nice when you have a question. It's critical when you have a problem. We believe that you can give yourself the most chances by giving yourself the most choices by calling us at 212-CHOICES. We're super convenient. We're located by most buses, subways, trains, Grand Central Station, Penn Station, PATH trains, and Port Authority. We're right in the middle of those stations, Grand Central, Penn Station, PATH, and Port Authority, just a few minutes walking. So we believe we're super convenient, but we're not only super convenient, that we're pretty super. So give us a call, and we have a call now, so we'll see what's up here. Radiosurgery New York, you're on the radio.
Hi, yes. I was wondering if Dr. Lederman was taking any more phone calls this morning.
Yep, you're on the radio right now. Good morning.
Oh, good morning. Is this Dr. Lederman that I'm speaking to?
Yep, you're talking to 50,000 people on WOR. Good morning.
Oh, good morning, Dr. Lederman. I had called several months ago in November looking to get some alternate treatments for my father. And you were very kind. You got back to us right away. You sent me the materials. My dad actually called you and you spoke to him. When he went to his internist didn't encourage him to do this and to get even a consultation, which broke my heart because I really want to get him out there to you for a consultation. And I asked my dad what the doctor said, and he just said that he didn't think it was for him, that he may bleed. And I just want to encourage my dad to get a consultation with you. And I was just wondering if I felt like some testimonials, and I know you have a lot of them on the air, might help him to feel encouraged that in his situation, because he has atrial fibrillation that he's being treated for congestive heart failure, plus this diagnosis with kidney cancer, which they don't have any idea what stage it's at because they couldn't do a biopsy because they thought it was going to be too dangerous.
Well, number one, the reason why we say to get a fresh second opinion, if you go back to your old doctor and say, well, what do you think about going to Dr. Lederman? The old doctor is going to say, I already thought of that. If I thought it was so great, I would have done it already. So going back to the old doctor to get a fresh second opinion will never happen in a million years. So it's exactly the wrong thing to do. And that's why we tell people, if you want a fresh second opinion, you've got to make a break and go in and get a fresh second opinion. Your old doctor is never going to say, oh, I forgot about that. You should have radiosurgery, number one. Number two, about kidney cancer, you can easily stage him up. We could have him staged in less than a few hours to know exactly where the cancer is and the extent of the cancer. And nowadays, you don't necessarily need a biopsy of the kidney to have a pretty good idea whether you have cancer or not. And number two, you can find out where the cancer is, if it's in the kidney only or beyond the kidney. Number three, our success for kidney cancer, we've been treating kidney cancer with radiosurgery for 20 years. Our success rate's over 90% with cessation of the tumor, shrinkage, or disappearance of the cancer without the surgery or loss of kidney. So there's lots to talk about with your dad, and I appreciate your kind words, and I do try to call everyone back, and I do try to make sure people get information. But if you want a fresh second opinion, he's got to cut the umbilical cord at least for a few minutes and come in and talk about it. We don't advocate that he leave his doctor, but I think it's really important for people to get a fresh, true second opinion. And so many people make the mistake that your dad did, which is he said, oh, I'm going to go to Dr. Lederman. And the old doctor said, no, don't go there. I thought of it. It's useless. He probably doesn't know a thing about radiosurgery.
That's exactly what I said to him, because he consulted with his internist, and I said, Dad, he probably doesn't know about radiosurgery. Just let's go for consultation. It's been since November, and as I'm listening to you, I'm thinking, oh, God, this is probably spread. They see two tumors. In November, there was one on his right kidney. I'm sorry, there was one in his kidney, but there was also one on top of each kidney. And I'm just thinking, oh gosh, it's probably spread so much since November. So, and I'm obviously not giving up and encouraging him to go. And I don't know if there was any written testimonials that someone could actually send to my dad, just to, I don't know, might help to encourage him to, like you said, just forget about what his other doctor said and come for a consultation.
Look, if he thought that would help, we could give him a name of I have a patient I'm thinking of right now. We treated for kidney cancer 15 years ago. She's been in remission ever since. So kidney cancer is one of those cancers which does not respond to chemo very well. It does not respond to standard radiation. I'm an internist. I'm a board-certified internist like your dad's doctor. And I can tell you that as an internist in America, training about radiation and radiosurgery is about zero. We know as much of making an atomic bomb as about radiosurgery. So it's just not something that's in the daily life of an internist in America to know about radiosurgery. And so if you don't ask the right person the right question, you're going to get a lousy answer and be misled. And you could easily...
About there might be bleeding, and that concerned my dad because he's on a blood.
It's just the opposite. It's just the opposite. There's no cutting, no bleeding. And I told you earlier in the show about a woman who had bladder cancer where we used it to stop bleeding. So no, there's not bleeding from radiosurgery.
Okay. All right. Well, thank you again, Dr. Lederman. I'm going to encourage him, and I actually hope he's listening. I tell him to listen on Sunday morning, so I'm hoping he turned on the radio and is listening this morning.
All right. If I can do anything to help, please let me know. But we do try to...
If you by any chance can get any type of testimony that he might be able to read, that might be, or talk to
if you call me during the week and that's important to him, I will get him the name of a patient who's gone through the treatment, and she can explain what's happened to her and how it's affected her life in a good way. I mean, she had kidney cancer. She had 5 treatments 15 years ago and has been in remission ever since. The cancer never traveled, never spread, never recurred. She's never had other treatment. She's never had chemo, surgery, or anything else. Just 5 treatments to the cancer in the kidney. She has her kidney intact and is fully functional.
Wow, that's wonderful. That would be wonderful for him to hear. Well, thank you so much, Dr. Lederman. God bless you.
All right.
Great work. God's work. Thank you.
All right. God bless you and thank you. Good luck with your dad.
Thank you. I'll give you a call during the week.
Okay, bye-bye now. Okay, I wanted just to talk a few minutes about a patient who came to us with metastatic prostate cancer. So he's one of those men that didn't want to get treated or didn't know about his cancer. The cancer traveled to the bones. So it's prostate cancer, stage 4. He started on hormonal therapy. He came to us to treat the bones, and we're treating the cancer in the bone to get rid of the pain. But we're also giving a few treatments to the breast so it doesn't get painful enlargement of the breast. Many men get gynecomastia, which is breast like a woman when they have hormonal treatment for prostate cancer. So if you're thinking about hormonal treatment, if you, God forbid, your cancer's traveled, think about using our treatment to stop the development of painful enlargement of the breast. It's just about the end of the hour. This is Dr. Lederman. We have another show tonight on WOR at 9 p.m. If you have questions during the week, call us at 212-CHOICES, and we'll send you a booklet and DVD, or we'll answer your personal questions. Again, 212-CHOICES, 212-246-4237. Thank you for calling in, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212